The World Health Organization says the Omicron variant has now been reported in 23 countries around the world and says it expects that number to rise rapidly. The health body says it should see the first data on how transmissible the strain is in the coming days. Early evidence is suggesting that Omicron doesn't cause severe illness and that the vaccine efficacy is not reduced by it. But the WHO says vaccines, mask wearing and social distancing are still the best way to contain the virus. The WHO head says ending the pandemic is not a matter of time, it's a matter of choice.
Globally, we have a toxic mix of low vaccine coverage and very low testing, a recipe for breeding and amplifying variants. That's why we continue to urge countries to fully fund the ACT Accelerator to ensure equitable access to vaccines, tests, therapeutics all over the world.
The European Union has brought forward the date at which vaccines will be available to children by 2 weeks. The European Commission President Ursula von der Leyen says she's spoken with American-German vaccine makers Pfizer, BioNTech to guarantee success to a new batch. She also raised the idea of bloc members discussing the possibility of making jabs against COVID-19 mandatory because too many people are still refusing to get shots voluntarily.
We are in kind of a tug of war. On the one hand, you have the virus and the variants. And on the other hand, we have vaccination and boosters. And I want the second part to win.
Our correspondent in Brussels, Shona Murray, told us that Ursula von der Leyen's comments were suggestions rather than directives, as health is a competence that must be decided by each individual member state.
She made the point that she never thought she'd see the day that we have this deadly virus, this deadly crushing virus, and we have vaccines, yet 1/3 of the EU population is unwilling to get vaccinated. That's about 150 million people. She also made the point that out of that, there are many people who can't get vaccinated for medical reasons and, of course, small children under the age of 5. So that everybody else who can get vaccinated has an obligation to protect those who can't. And so she said it's something that needs to be discussed. But, of course, we've seen some countries, Austria in particular, going ahead and saying that there will be mandatory vaccination by February because, of course, you see all across Europe a disproportionate number of people in ICUs that are unvaccinated. Those who are in hospital that have been vaccinated often have underlying conditions. And on the travel restrictions, I think the emphasis is on trying to keep the single market as open as possible and making sure that people are vaccinated so they can move around. But we've seen a number of member states, Ireland, Portugal, for example, ensuring that people still have a negative PCR test regardless of their vaccination status.